and welcome to this short special on emphysema with yours truly, alveoli. So, emphysema, very underdiagnosed disease in this country. It is also 1.5% of the population, or 3.5 million adults have been diagnosed with this disease already. So, the first observable symptoms of emphysema are first noticed during physical exertion, then at rest. Common symptoms include dyspnea, tachypnea, prolonged expiration, wasting, emphysema posture, shortness of breath, chronic cough, orthnia, wheezing, peripheral cyanosis, accessory muscles during breathing, barrel chest, and malaise. Major risk factors include tobacco smoking.
Come on over here. My name's Smokey. Have you ever tried something called a cigarette?
No, I haven't.
So, though it doesn't discriminate between men and women, emphysema does typically affect more males due to the fact that more males tend to be smokers. It is also typically affects people over the age of 40, and usually does not affect people younger. Determining if you have emphysema, it goes through a set of diagnostic testing, which may include things like a history, a physical exam, a chest x-ray, blood tests to look at O2 and CO2 exchange, also talking about the important treatment of cessation of smoking.
So what's bothering you?
It's my neck, my back, my alveolar sacs.
Alveolar sacs are the small air sacs within the lungs where a majority of the gas exchange takes place. Emphysema breaks down the alveolar sacs and the walls of the alveolar sacs, creating one large space and preventing the lungs from doing their job. Over time, the walls of the alveolar sacs will weaken and rupture.
So what do you think?
I don't know, man.
Did you know that 10 to 15% of all smokers develop COPD? Other risk factors include heredity, exposure to indoor and outdoor pollutants such as fumes, and elderly people experiencing loss of elasticity of their lung tissue, and finally, prolonged respiratory difficulties such as chronic bronchitis that reaches the lower levels of the bronchial tree. So now we'll move on to talk about some medical management techniques for patients here with emphysema. The first technique is to teach them how to pursed lip breathe. Adam, do you remember how to pursed lip breathe?
I think so.
Okay, can you show us? No. You're supposed to breathe in through your nose for 2 seconds and out through your mouth for 4 with the pursed lips. Perfect. The point of this breathing is to open and inflate the alveoli to prolong exhalation and prevent collapse. Contrary to what some may think, exercise actually does not improve pulmonary function in these patients. Although they are treated with oxygen pumps, pulmonary rehabilitation, which can include physical therapy, and diaphragmatic breathing techniques. In extreme cases, these patients may experience lung transplants or a procedure called LVRS, lung volume reduction surgery, in which surgeons will go in and resect damaged areas of the lungs affected by the emphysema. For medications, they may be taking bronchodilators, oral steroids, or antibiotics because they are prone to other pulmonary infections such as asthma and bronchitis.
So now we're going to talk about the role of the PT a little bit. Cardiopulm is a notable specialty
in physical therapy. This deals with inspiratory muscle training. COPD can cause balance deficits, which increase risk for falls, especially for those with oxygen tanks. So PT can improve balance scores as well.
Emphysema is categorized as a chronic obstructive pulmonary disorder. This means patients have difficulty getting air out. Those with emphysema generally have a lifespan that's 5 years shorter than average. There are 3 types of emphysema: centriacinar, panacinar, and paraseptal. Centriacinar spreads mainly to the upper half of the lungs. Panacinar is found in the lower half of the lungs and it destroys the alveolar tissue. Paraseptal localizes around the septae of the lung or pleura. Regardless of the type, the disease is uncurable and the lungs will be affected for the remainder of the patient's life.
Emphysema is
Tried something called a cigarette? Have you ever tried something called a cigarette?
No, I haven't.
Why don't you give
Indoor and outdoor pollutants such as fumes and exhaust. Elderly people.
Let's restart.
a physical exam, prior functional. What is emphysema? Diagnostic testing. Due to the fact that mostly men are smokers.
You should. Let's keep that in. Wait. Let's keep.
Prevent collapse. Contrary to what some might think about pulmonary issues, exercise actually does not increase pulmonary function.
Restart. Restart.
Why did you do
Why
that?
did you leave? Probably what?
Less
Lean
pelvic
back a
thrust,
little.
more lean.
More lean which way?
Back. Not that much.
Too much.
And paraseptal. That's not how you say it, right? Centriacinar spreads mainly.
Oh, we're just doing the popping part?
Yeah, just be angry. Just go for it. Keep going.
Perfect. The point of this breathing is to